Hi, everyone, and welcome to the May panel for Crisis Ready. I'm Andrew Schroeder. I'm the Vice President for Research and Analysis at Direct Relief, and I'm joined by my colleague, Caroline Buckey.
Hi.
There's Carol.
Hi, everyone. I'm stepping in for Sachit, who's is dealing with an emergency. So my name's Caroline Buckey. I'm a professor of epidemiology at the Harvard T.H. Chan School of Public Health.
Great, and we're going to be talking this week about fire season 2021. There's been, I think, a lot of discussion about the potential severity of the fire season this year. There's a lot of publicity that has already articulated how dry the West is this year. The entire state of California is currently considered to be in moderate drought, with the northern part of the state, roughly about 30% of the land area, currently considered to be in extreme drought. So the fuel is there for potentially serious events that can have enormous adverse consequences, as we've seen in the growing events over the last couple of years. Direct Relief in particular has scaled our wildfire response dramatically over the last 5 years, with by far the most extensive response happening last year to support communities that were displaced by the wildfires, and the first responders that are increasingly placed under dramatic amounts of strain to fight what is now this increasing wildfire burden. And we're joined by a group of researchers and public sector and safety net professionals that are both looking at the kind of key questions around what the healthcare impact of these events may be, and how we're actually working to prepare for the upcoming season. So we'll be joined by Dr. Matt Kang, who's from the Department of Epidemiology and Population Health at Stanford University, Dr. Joan Casey from Columbia University, Eric Sergenko, who's with Mariposa County, and Mike Witt, the Chief Medical Officer for the California Primary Care Association. We'll start with Matt, and then go to Eric, Joan, and Mike in order. So without further ado, Matt, would you like to take it away?
Sure, thanks, Andrew. I don't want to start off by making Andrew a liar, but I'm actually going to be talking about the 2019 wildfires and a little bit about the upcoming year, but mostly about 2019. And before I start, I do want to sort of acknowledge Shenyu, who's actually on the call. Shenyu did all the heavy lifting for the data cleaning and munging, and has graciously allowed me to present on our behalf, but certainly deserves all the credit here. So I think everybody on the call knows that wildfires are a problem, right? So these are all the Red Book fires in California on the y-axis. So each line is a fire, and time is on the x-axis starting in March 2019. And the circles here are centered around the start date, and the larger the circle and the darker the line, the larger the fire. So there were 61 fires that burned at least 300 acres in 2019. The official 2020 Red Book, as far as I know, isn't out yet, but it's certainly going to be much more than this. In 2020, there were 74 fires that burned over 1,000 acres. And just to sort of remind you of this fire season, we're talking about the fire season that involved the Kincaid Fire in Sonoma and the Walker Fire. These were the two largest fires. And these large fires can obviously result in sort of smoke and airborne hazards from burned materials and plastics, or water pollution from melted pipes, landslide risks. There's all sorts of environmental hazards that are associated with these large fires. But I also think that year, it's important to note the direct risk of life that we saw. So there were fires that happened in really dense urban areas. So now the size of the circle is the number of households within 5 miles of a fire perimeter. And I just want to point out the Saddle Ridge Fire, which had over 200,000 households within 5 miles of the perimeter, and the Getty Fire, which had over 190,000 households. So as you can see from these photos of the Getty Fire, these are quite problematic, especially in urban areas where, in addition to the air pollution, the environmental hazards, and the landslides, they pose this direct risk to life, and they often hinder our ability to evacuate or respond. in addition to all that, right, they hinder our medical infrastructure. So here's the size, here the size of the circles are the number of hospitals that are within 5 miles of the fire perimeter. And in 2019, when we were talking with the California Department of Public Health about this project, they had mentioned how just the week earlier, one of the hospitals in Sonoma had to evacuate and then evacuate again from the other hospital the next day, right? And so understanding where these fires are in relation to hospitals is sort of crucial for our planning. And these are all things that we've been thinking about at Crisis Ready, and I think the public sector has been thinking about for a while. More recently, though, we've been thinking about sort of the less obvious effect of power outages. And power outages can be quite deadly. So we saw the Texas winter storms earlier this year. And this figure is from a narrative review actually led by Professor Joan Casey, who will be speaking later. And you can see California experienced 70 major power outages between 2000 and 2016. And these major power outages are defined as having at least 50,000 households affected or 300 megawatts of unplanned power loss. So we're interested in this particular aspect and not these like major ones, but sort of the smaller outages that can be problematic for people who depend on stable energy. And so to better understand California, we got some data from poweroutages.us. And here on the y-axis, I'm plotting the number of customer hours per day in millions. And on the x-axis is 2019. And so each line is one of these large 6 counties in California. And I just want us to get a sense of the variation across these counties. And obviously I can do this for all counties in California. So here this plot is the same thing, but it's all 58 counties. And I think there are a couple of things worth pointing out. So this first bump here we can see are the rolling blackouts in Los Angeles and other Southern California counties in 2019. And then there are these public safety power shutoff events in blue here. And these are the specific days and counties that are experiencing a public safety power shutoff. And so these PSPS events are preemptive de-energization events where the power utility just sort of shuts off power due to high winds or other sort of high risk times to minimize the risk of a potential fire. So these aren't even directly from the fires. And there were a total of 115 of these PSPS events where if you count an event as a continuous block of time in a single county, it affected 45 of the 58 California counties. And in total, there was nearly a year worth of county days under a PSPS event, right? So if you counted up all the household days, we're talking over 100 million household days. And these events are likely to get more frequent due to climate change and aging infrastructure and more wildfires. So we're interested in sort of understanding these events and particularly like how these events affect not just PSPS events, but power outages in general affect medically vulnerable populations. So I don't have a ton of time, so I'm just going to go over sort of 4 questions that we were focused on. So while these shorter events are inconvenient, they're usually not medically meaningful. So the first question is, how often are medically meaningful power outages occurring? In other words, like what is the scope of our problem? Maybe it's not actually a problem. And the second, where are they occurring? What is the spatial distribution of these medically relevant power outages? The third question is, what is the intersection between medically relevant power outages and where the medically vulnerable populations are? And then lastly, what are the county level characteristics associated with medically relevant power outages? And we think these are sort of the 4 fundamental questions you sort of need to understand before you can really think about planning and addressing power outages and health. So before we can define a medically relevant power outage, we need to think about, about what is a power outage, period. And so these are ecological data. We can't actually track a single household over time. So we need some threshold to remove the noise. And I'm just going to say that a power outage is an event that affects at least 500 households. And this is arbitrary. We do this across a bunch of different thresholds, but for now, I'm going to focus on 500. And then I'll plot here on the x-axis the duration of these events. So we're looking at events ranging from lasting 2 hours to 10 days. And on the y-axis, just the number of times we've observed these events across these 6 counties. So for example, San Diego County had 400 events that impacted at least 500 households and lasted at least 2 hours. So again, like before, I can do this for all 58 counties and we get something that looks like this. And so you can see that these like 2 and 4 hour events are fairly common, and these really, really long multi-day events are fairly rare. So the ends of the spectrum are as we would expect. And after a bit of expert consulting with the physicians in Crisis Ready, we decided that we're going to focus on 8 hour and 24 hour one-day events, because this is the point where these events can really become medically relevant. So the first question then is, what is the scope of the problem? There were nearly 1,100 8-hour events in 2019 across almost all the counties, 56 of the 58 counties, accounting for over 111 million household days. And there were 149 24-hour events across 45 counties, accounting for 8 million household days. So these are fairly common, and they can impact quite a few people. So the next question was, what is the spatial distribution of these events? So here the 8-hour events are on the left, and you can see some pretty wide geographic spread. There are a couple of darker areas in the very top of Northern California, but these are largely just sparsely populated counties. And then for the one-day events, you can see they're obviously much less frequent, but there's still a bit of spread. It's not you can just focus on one area. It seems like they're all over California. So still focusing on these events, over 500 households, we have 8 hours on the left and 1 day on the right. I'm going to plot the number of events on the y-axis. And the third research question was, where are the medically vulnerable populations in relation to these events? So here the x-axis is the number of Medicare beneficiaries using electricity-dependent durable medical equipment, or DME. And so these are items of important medical equipment that need a stable supply of electricity. So they often have batteries and backups, but not 8 or 24 hours worth in general. And the size of the circle and the color is also the number of DME users. So this yellow bubble on the far right is Los Angeles County, and we can see it has the highest number of DME users, which makes sense. It's the largest county in California, but it's also had fairly few of these large events. So that's good to know. And then you can see this cluster of counties here, which have fairly large outages and also have a large number of DME users. And the dots here, the dot under this box here is San Diego County. So it does seem like most DME users are in Southern California. But in terms of the intersection of large DME and lots of events, those counties tend to be limited to these 3 counties. And then the last question we're interested in was, what are the county level correlates of these power outages? So for simplicity, I'm going to keep the y-axis the same, so it'll still be the number of power outages. And I'll keep the color and size of the circles the same, so it'll still be the number of DME users, but I'm going to change the x-axis over the next few slides. So here on the x-axis, I plot the wildfire hazard potential score. So this is just, in a given area, how likely is it to experience a wildfire? And as we can expect, these bigger power outages tend to be correlated with areas that have higher potential for wildfires. But that said, it's a fairly weak correlation. So in addition to just wildfire hazards, what other county level characteristics are associated with these long power events so that we can inform our intervention? And it turns out that income is just a really bad predictor. And this is a little surprising at first, but really before I said that these events are correlated with wildfire potential, and those tend to be areas that live in along the wildland urban interface. And the people who live there are largely divided into either like very rich people who want to live in isolation on a hill overlooking the ocean, and people who just can't afford to live in a more convenient, more urban area. So it sort of makes sense we don't see a clear correlation here. And therefore, it sort of makes sense that we don't see a lot of correlation with social vulnerability. So here on the x-axis, I'm using the Healthy Places Index as our measure of social vulnerability, but this is true for SVI and other measures. There's just no correlation between where these events occur and the vulnerability of the county level. There is, however, apparently a weak correlation with how diverse the county's population is. So here, by diverse, we're counting the fraction of the population in that county that is non-white, and the lower that fraction, the more events there are. And in this case, we think what's happening is that minority populations tend to live in more urban areas, which are less likely to be near the wildland urban interface. But there's still a lot, I think, to figure out. And And so that's sort of what we've been thinking, but there's a lot of active projects going on right now at Crisis Ready. And so I just want to point out some of the work that we're already doing and starting to do in terms of next steps to build on these analyses. So the first is obviously sub-county level analyses. I think county level is a good place to start, but ultimately, if we want this to be useful for local departments of public health, we're going to need some sub-county analyses. And then we plan on trying to incorporate hospitalization and mobility data, a better understanding of medical needs and where people go during fires or immediately after fires. We're trying to create a dashboard with some historical data, but also near real-time data in terms of fire perimeters, so that departments of public health can go to a single place to get that sort of information. And obviously, we want a better accounting of the resources, so shelters, hospitals, long-term care facilities, and that kind of thing. So that's just a quick overview of what we've done at Crisis Ready and what we are doing next. And I think that's it for me.
Thank you, Matt. I would like to just quickly emphasize on the dashboard tool that Matt mentioned, that Crisis Ready is working with support from google.org to put a dashboard tool together that's going to be available as a resource to folks in the state, folks in the safety net, and others to be able to understand some of these dynamics as we go forward. So stay tuned for that work. We're going to turn it over to now Eric Sergenko from Mariposa County to talk about kind of what the front lines look like from the standpoint of policymakers that are focused on this year. So Eric, we'll turn it over to you.
Got it. Good morning, and thanks for inviting me. I am going to see if I can successfully share my my slides here. And let's see. I'll ask Andrew, are you getting that?
Looks great. Thanks.
All right, beautiful. So good morning, and again, Eric Sergienko. I am the health officer for Mariposa County within our Health and Human Services Agency. For those of you who don't know, Mariposa is a small rural to frontier county, just shy of 18,000 in population, but also about a third of our county is Yosemite National Park, which receives about 4.5 to 5 million visitors a year. In addition, we have surrounding national forest lands, the Stanislaus and Sierra, that receive, again, more visitors. So our economy is largely 70% tourism driven, and then the remaining 30% is ag and then other smaller industries. There are a number of adjacent counties to us that are similarly small in nature in terms of population, but large in size. And because of that, in this area, we have limited medical and public health capacity, which in and of itself creates a challenge that is different than the larger, more urban communities. We have a significant recent fire history, and starting with the Rim Fire, or even going back further than that. But of most recent history, the Detweiler Fire kind of kicked off the July 2017 California fire season, and then wrapping up the 2020 fire season. The Creek Fire was actually in Madera County, but as the largest single point ignition fire in the history of California, produced a significant amount of particulate matter and other volatilized fire products that drifted over into our county. So as we look at the impacts of fire, we also have to look at the impacts of fire from a smoke perspective, and recognize that that just doesn't stay in the jurisdiction where the fire is at, and that we get that throughout the entire area. So what does fire season 2021 look like? Well, as Andrew said, we're in extreme drought. Our fuel moisture contents are low. The conditions now really are representative of mid-June to almost early July. And this was reflected yesterday. I will say one of my side jobs is I'm a volunteer firefighter. So this Live Oak fire was yesterday, went through yesterday night. I got off the fire line about 11 o'clock. I think that is going to be our picture for the rest of the fire season. That threat is commingled with the capability and capacity that's available right now. The federal resources for fire response are about 60% of normal. That was brought on partly due to COVID. The feds were directed to not have congregate living for their fire crews, so that reduced their ability to house fire crews. And then CAL FIRE has fewer hand crews. For those of you who are not from California, we use prison inmates for a large number of our fire crews, but due to COVID, there were a number of early releases. And so we're seeing about 40 to 50% of available hand crews. And that's kind of the other impact we're seeing in terms of the fire season is we're still in the midst of COVID, even though vaccination has made a huge impact on that. So if we have fires, if we have evacuations, we have to look at the impacts on tourism and the funding mechanisms there, and then congregate shelters. And I'll talk a little bit more about that. So that's the fire season. And then as Matt alluded to, we've had these public safety power shutoffs. And because a number of the large fires that have started over the last 2 years have been due to power lines down, PG&E, our power generation for the northern part of California, said that there's going to be an increase in the number of public safety power shutoffs. For us in Mariposa, that's going to be about 17%. So really, we're focusing on that at-risk population rather than our general population. So identifying early on using Empower and other databases to find who has home ventilators, who has other DME, and then thinking about how we're going to do that with COVID in the background. At the same time, we're working in conjunction with PG&E to establish these community resource centers where otherwise well people can go and get power generation for their laptops, their et ceteras, and then also get information. What we have found in the last several PSPSs is that PG&E is spread so thin that we as the county end up being responsible for establishing and maintaining the CRCs. So all of this is happening in the light of a pandemic. It's not gone away, even though the vaccine has mitigated it significantly. So we anticipate that fire camps will continue to do dispersed operations, and we will facilitate rapid testing for fire crews. With the Creek Fire, we did a lot of testing for those crews because, as you may know, fire camps are not located far away from the fire. So they have smoke impacts, they get camp crud, and it's hard to sort out the impacts of those or the diagnoses associated with those versus COVID. So testing is a big thing. Vaccination, huge. I will say it several times, is that if you haven't gotten vaccinated yet, please do. We will intend to use non-congregate sheltering until it runs out, and then again, smoke impacts and mitigating that ahead of time. With PSPS, we did this last year. Rather than try and bring people into congregate shelters, we put out small generation capability to those households that needed it. Some things that were successful for us, whole of government response. I can't overemphasize this, is that with the pandemic, with the fire, with the PSPS, it is not just a public health emergency. It's not just a law enforcement emergency. It's not a fire emergency. It's whole of government. And really what you want to do is bring along as much of the community as possible, recognizing that you're not going to get everyone engaged. What we have found with the pandemic and other fires is our strategic messaging through our Joint Information Center has been incredibly successful. Another plug for vaccination. The other things we message about starting early on is fire ready, preparing for evacuation, how to be ready to go in seconds and minutes. And then power generation, and as Matt alluded to in his presentation, generator safety. So people pulling their generators into their house, getting CO toxicity and bad things happening from that. Again, within our mitigating the health impacts, coordinated messaging through our JIC, having pre-scripted messages available that address the common concerns, the common aspects of fire response. Building this coordination between fire response agencies and health agencies so that we have the necessary fire information to formulate our health advisories. And again, letting the health departments, the public health jurisdictions being those sources of health information, but sharing that through the Joint Information Centers with all response agencies, and then developing FAQs to work through that. A slide I didn't throw in here because I ran out of time was thinking in the post-fire environment, the ability to do rapid needs assessments. And I saw Svetlana Swarodinsky from CDPH on this. She has been a tremendous help to us in the post-fire environment. And then I also saw Sumi on here from CDPH, and she has been helpful in sorting out the pre-fire stuff for us. So again, within the local health jurisdictions, being able to reach out to both the state level and academic level researchers and investigators to determine the impacts of wildland fire has been critical to us in our success here in Mariposa. And I think I just blitzed through those really darn quick, and I will pause there and end my slideshow.
Thank you. So I think what we're going to do, that was really interesting. Look at that context. I think what we're going to do is have all 4 talks and then do Q&A. So feel free to enter some questions in the chat, but otherwise we're going to move on to Joan Casey, who is an assistant professor at the Columbia School of Public Health. Joan, are you ready to share your screen? Great.
Yes, I am. This is 2021. You've always got to be ready to share your screen. Let me get on to the right. Great. All good? Fantastic. Okay, so yeah, thanks for having me here today. I'm going to talk about some of our work looking specifically at the Carr and Getty wildfires. And, you know, this is not news to anyone here. We're having more extreme events. Some of those events are wildfires, and we expect those to continue increasing over time. This is a nice photo. Matt also showed it. I just think this really highlights some of the challenges we're facing in California. Just how close wildfires are encroaching on human populations is becoming truly remarkable. We also have these spiraling costs of wildfires. So these are suppression expenditures over time. They appear to be increasing. These are property losses in California through 2018. So these aren't the most recent wildfires. I'm going to be talking about this wildfire that affected Shasta County. So just to step back for 1 second, as an academic researcher, I'm thinking about the relationship between wildfires and dementia, specifically Alzheimer's disease, but I'm interested in some things kind of on the pathway between both wildfire particulate matter exposure, the stress of living near a wildfire perimeter and potentially having to evacuate your home or experiencing some of these power outages. And so interested really in these 2 outcomes. And today I'm going to talk a little bit about something on the pathway, which is cardiometabolic disease or respiratory disease. And so nice to hear about these academic public health department partnerships. That's what this study was. So we actually were reached out to by folks in Shasta County that wanted to understand what had happened in their county during the Carr fire. And so we were able to partner with them and apply some of our techniques, use some of their data, and we worked on this study together over the last year. So Shasta County, all the way up here in Northern California. Here it is broken down at the zip code level, and the Carr fire boundary shown here. And then one other important thing I wanted to point out, they have kind of these 2 types of zip codes. This is up near, not surprisingly, Mount Shasta. It's quite mountainous. There are zip codes that are located in the mountains, much higher elevation, much lower population density. And then there are these valley zip codes where most of the people in the county live. The valley kind of creates an area of increased air pollution exposures at baseline as things kind of filter down there. And so same problem with wildfire smoke, it kind of collects in the valley where people live. And so this analysis thinks about the importance of differentiating between those 2 types of places. So just to give you the breakdown, we have a bunch of zip codes in these mountain areas, very few people living there. And then as you can see, Redding is the major city in this county, and the bulk of people in Shasta County live in Redding. Okay, so how did we think about wildfire exposure. Here we are really interested in looking at wildfire particulate matter. And so I mentioned there's this like background particulate matter level that we want to take into account that can differ across place. And then we're interested in also estimating the additional piece of particulate matter from wildfires. So to do this, we use kind of a multi-stage approach. It first relies on identifying which zip codes are smoke plume exposed every day using NOAA's hazard mapping system data. And then we use US EPA monitoring data to know what the overall PM 2.5 concentrations are. And then we use this spatiotemporal multiple imputation approach to estimate daily zip code level wildfire PM, as well as this non-wildfire PM. So we're able to control for both of these things in our models. And so that's kind of this new development, and I think can be quite helpful to think about. I'm happy to talk a little bit more about that. So here's just to give you a sense of during the Carr fire, these are the valley zip codes, what the distribution and changes in wildfire PM looked like. So you can see at the very beginning of the wildfire in the second to last week of July, levels of wildfire PM are essentially negligible. The fire hadn't started. Then things really start ramping up and then peak and then go back down. And so there's some variability across these zip codes. Not so much, it's more variability in time. And here's on the top panel, the weekly mean wildfire PM levels in Shasta County between 2013 and 2019. So we did look at the Carr fire specifically, but we are also interested in looking at just overall wildfire PM exposures in this county over time and how those relate to health outcomes. And you can see I've highlighted the Carr fire, which were the highest levels of wildfire PM experienced in Shasta County during this time period. Along the bottom, our two main outcomes of interest were respiratory as well as circulatory disease related emergency department visits. And so here I'm showing you respiratory disease visits. The lines are representing what we would expect. The dots are representing what we actually saw. And so we were able to look at these two things together. For analyses, we use time series models to estimate this association between the weekly wildfire PM 2.5 concentrations and the logarithm of the respiratory and circulatory disease ED visits. So time series are nice because they control for things like trends and cycles in the outcome data that could otherwise kind of lead to spurious associations. So in our analysis, we used a dichotomous, so a binary exposure variable, weeks where the average wildfire PM was greater than 5.5 micrograms per meter cubed. This was the average wildfire PM during the study period, compared to weeks where the average level was lower. So you'll see that on the next slide. Okay, so here, so here what you'll see are the results of our analysis. So at the top, you're looking at the respiratory disease ED visits, and at the bottom, you'll see the circulatory disease related ED visits. And so we also ran some lagged models here, but the main results overall related to wildfire PM in weeks that had greater than 5.5 micrograms per meter cubed on average wildfire PM, we saw a 14.6% increase in respiratory disease related ED visits. And then in the next 2 weeks after that, we saw no increase. So it really appeared confined to that week where levels were actually elevated. And then we actually didn't see a signal related to circulatory disease visits and overall wildfire PM or the Carr fire explicitly. When we looked at the Carr fire by itself, we saw that the Carr fire in Shasta County appeared to increase respiratory disease related ED visits by 27% over expectation. And so that's obviously a pretty large increase. Okay, so I just wanted to mention also our work that we have related to the 2019 Getty fire in Southern California. So here we're using a different type of methodology. Again, the Getty fire was right here close to Santa Monica in the hills. And we had evacuation, large scale evacuation of where many people lived. Here we partnered with Kaiser Permanente to use their electronic health record data Here we were focused on people that previously had a dementia diagnosis, and we wanted to see what their healthcare utilization looked like after the fire. So this was about 25,000 people with dementia living in this region. And here we wanted to look at disaster exposure in contrast to the prior study where we were looking at exposure to wildfire particulate matter. So here I'm just highlighting the zip codes that were considered disaster exposed, meaning that they had to evacuate or in a zip code adjacent to an evacuation zone. The other zip codes were our control group. So this was a zip code level daily analysis. Again, our outcome were all healthcare visits among people with a prior dementia diagnosis. And we used a causal difference in differences model where we are essentially comparing post to pre visits among the disaster exposed zip codes, and our second difference being the post to pre among disaster unexposed. This differencing method essentially helps us control for temporal trends and isolate the effect of the wildfire itself. So in this kind of smallish study, and where not so many people were exposed, you saw there were just a small number of zip codes that actually were disaster exposed. We appeared to see approximately 0.5 additional visits per day among individuals with dementia per zip code in the month following this fire. So kind of an initial signal. Very few people have been thinking about, well, maybe they've been thinking about, but very few people have been reporting results related to this disaster exposure and kind of a psychosocial stress response that I'm particularly concerned about, especially among this vulnerable older adult population. So I just wanted to conclude talking about one group of main interest to me, which are these older adults and why we might be worried about them. So in terms of access to care, we're worried about folks being able to refill prescriptions, get to the healthcare system during these type of events. Matt mentioned DME users, and so we've actually characterized this population in the Kaiser Permanente population. We see increases in this durable medical equipment use over time in California among older adults, but also among people younger than 65. We see upward trends. So want to continue thinking about those groups. Older adults we know often lack social support, which can be problematic under a disaster scenario. So we want to think about that. We also know, though, actually, this is not true across the board, and older adults can be very resilient and provide social support to others. So this is an area that I think we need more work. And then older adults may be more reluctant to evacuate. We've seen this from other studies. This is for a variety of reasons. And if they do evacuate, this can fragment social networks that are particularly important for adults living with dementia. So another area for us to keep thinking about and how we can support evacuation if necessary in this older group. And then there's also this concern that cognitive impairment interferes with risk communication among older adults. Are they able to access warnings and disaster orders? It might be difficult for them to follow them or understand them, depending on, if you're getting a text message, how this is conveyed to older adults. But of course, many older adults are very self-sufficient, but others have multiple comorbidities and require help with, activities of daily living. So an important group to keep thinking about. We have a lot of co-occurring factors, including power outages as well, and vulnerability factors among this group, including things like access to backup power. So I'll just conclude by reminding us, we know disasters will increase in frequency and severity. We know the size of the older adult population will grow. And so to protect them, we need to keep thinking about social and environmental determinants of health in this framework around wildfires and power outages. So I'll conclude there. You can take a look at this paper if that's of interest. And yeah, looking forward to the discussion at the end.
All right, thanks so much, Joan. And I'd like to just quickly then introduce our final speaker, Mike Whitty from California Primary Care Association. As we've talked about vulnerable populations, CPCA represents the safety net across California and has increasingly played an important role in responding to the health needs of vulnerable populations during wildfire and power outages. So Mike, please, over to you. I think you're on mute, Mike.
Thank you. Thanks a lot. Yes, thank you very much. And thanks to the three of you. I feel like from our perspective and ours, that is in the safety net world, that we become reactors rather than proactive. And I think that's one of the things that these disasters have really emphasized, is the need, the clear need to be much more proactive. And that is looking forward, as we're talking about sort of the subtext perhaps of what the discussions that I've heard from the three of you. And I'm sure a lot of the people that are on this call as well, recognizing that, yes, this is certainly about the fires that we've seen. And I actually practice, I'm a family doc and also a pediatrician, worked in and started up a rural health center on the coast of Marin County, where the Woodward fire happened in the Point Reyes National Seashore. And the learnings from these kind of fires are things that I think a lot of the people that are, certainly the CAL FIRE folks and folks that are actually on the front lines, are learning how to manage the forests in ways that are looking forward to minimizing the effects of some of these fires. The other issue, though, that I think that is writ large, and I think that certainly Matt and also Joan alluded to, is the issues, and also Eric experienced last night as a volunteer fireman, is the interface between occupancy and the wild areas. And that there are more people in California, and there are a lot of people that are living in areas where there's a lot of fuel. And I think that these are one of the things I saw where out in the Point Reyes area where we had the Woodward fire, people living in forests and recognizing that these are often beautiful places to live. And as you heard, that this is not necessarily, I think Matt mentioned for sure, that this is not just about vulnerable populations or homeless populations, and often contrary-wise, beautiful homes are being threatened and burning down because of the fact that there's a lot of fuel around them. And I think that one of the things, though, that that emphasized, and Eric emphasized, I think, and I really want to focus on here is that, and also Joan mentioned in some detail, is the effect of air pollution, the effect of smoke pollution, and what we can do moving forward, recognizing that wildfires are going to be in our lives. Eric said this writ large, that this is something we will and do live with. So how do we recognize, okay, we want to prevent them as much as possible, but at the same time, we want to be able to say, okay, we can't prevent all of these. We know that let's not go there. Let's go to a place where we can say, how do we individually and as communities really protect ourselves from the effect of the air pollution, groundwater pollution, and also the septic intrusion that can happen with landslides and the kinds of effects that happen where the landscape has been burned and basically scorched to a point that there's not the usual protection of both the land and then also the air. The particulate matter in the air has all kinds of nasty things in it. Looking at the CDC's website, it includes carbon monoxide, nitrogen oxides, and various organic compounds that are precursors to ozone. So that these are all things that affect not just people with chronic obstructive lung disease, cardiovascular disease, and kids with asthma, but everybody. This is not healthy air to breathe. It's like living in the 60s in Los Angeles County with terrible smog. So that how do we actually get to a place where we can say, we need to protect ourselves from bad air? And as Eric alluded to, it's not just where the fires are, because smoke really travels in long distances, especially with wind. So how do we actually then protect ourselves? One of the things that the CDC alludes to is that N95 masks, not cloth masks, but N95 masks are good protection against most of this particulate matter, but there aren't enough of them. So is there something that we should be looking to the future for in recognizing that the kind of fabric, or the kind of fibers, I should say, that are in N95 masks are something we need to look forward to and say, it's not just wearing masks in flu season moving forward to prevent the kind of stuff that COVID is exposing us to now. It's also looking at what we need to do in terms of personal protection moving forward, looking at air quality issues that are going to occur for us with the fires. So I think that these are things that we really need to pay attention to. I do want to say one more thing, and I'll stop. That is that I work in the safety net. There are many issues that will affect the vulnerable populations, homeless, et cetera, that have to do with the exposure to bad air. And I think that is, so one of the things that we need to look at, us providers, healthcare providers, is how we can get out of the four walls that we work in and get to people to be able to really help them, whether it's homeless encampments, shelters, going to people's homes, as Joan alluded to, people with dementia that really can't move and shouldn't try to move or be moved into places where they might get exposed to people that are sick. We need to recognize that the model for how we take care of people needs to change dramatically outside of walls, and not just doctors and not just nurse practitioners doing the care, but a team of people that work together, communicate well together, and be able to really do the kind of work that we can do. The last thing I'll say is that right now we're really challenged, of course, and I think as Eric alluded to as well, with COVID being on top of all of this, kind of larded on top of this whole issue with wildfires, and with with what happens with wildfires and cold chain and supply chain interruption. How do we actually maintain, particularly the Pfizer and the Moderna vaccines, which need to be cold, to make sure that there is no cold chain interruption to being able to get enough vaccine to the right people? This is a problem for us right now, and we're learning stuff from the wildfires and from COVID. And I do want to say that this is an international problem. Pandemic means whole world. So if we can control it in California and use that as a paradigm for how we can work and help other people elsewhere, then I also know that working in the national focus, on a national focus with community health centers around the country, we're doing better than most of the states. So there's need to actually spread some of this learning to other states and then eventually to other countries as well. And I'll stop. So thank you, and ready for any questions, of course. Thanks.
Thanks so much, Mike. Really great perspective. And we have a few minutes for discussion. And so if people would like to put questions in the chat or raise their hand and we will call on them, I guess I would kick off with a general question that builds on what you were just saying. So you know, we've all of the speakers have commented on this year, the intersection of COVID and the possibility of wildfires. And I wonder, I wanted to ask first Joan maybe to say something about the intersection of her work on elderly populations with dementia and other cognitive challenges in this context of COVID, given the last year of potential isolation, and what you think that means for this summer and how we can protect those vulnerable groups. And then maybe to you, Mike, you know, you say that we need to build teams that go out and engage with the community. Is COVID going to be, as you say, the opportunity to galvanize a new type of practice for engagement that actually works better for wildfires, but particularly in this context? So we can start there, and happy to hear from all four speakers, but maybe Joan, you can start, and then we can go from there.
Yeah, I mean, I think that this is kind of a microcosm of what we can expect under climate change, right? These compounding problems that are going to keep coming up. This year, you're talking about wildfires and COVID. In the future, we might be talking about sea level rise compounding with power outages. It's going to continue to challenge us. And one thing Mike said that I think is right is we need to start rethinking our strategies, and that it's not a one size fits all for folks during a disaster. And so for some of these more vulnerable populations, especially during COVID, right, we can't really be asking folks to evacuate to a central site, of course. And what other ways could we support people, whether that's through decentralized solar and storage so that there's power to homes that can at least keep people comfortable, what else this is going to look like. And then this summer, I mean, in the context of this research, yeah, it's really tough, and it also, from a research standpoint, is extremely challenging to disentangle what's going on. And so this is when it becomes, really important to have better health data on folks. So, for example, it would be really hard this year to use emergency department visits to understand what's going on because people aren't going to the ED. And we don't know who's vaccinated. And so now having like the finer grain electronic health record data where we can track individual people over time, in addition to knowing other factors about them, is, those sort of data streams become really important.
Yeah, wonderful. Mike and Eric, I wonder if you want to weigh in on how we could reimagine some of the reaching communities in this context.
Well, I'll start, but love to hear from Eric. To address the issues around how to actually, and I think Joan, as Joan alluded to as well, how to address these populations in these kind of crises. Let's look at the fact that, as she said, let's expect that there will be different kind of crises moving forward, and how then can we actually develop the kind of team? In the rural areas, I work with EMTs all the time, paramedics, EMTs, they're part of the team and they're out there. I don't want people to go to the emergency room because, first of all, it's far away. Secondly, it's expensive care. And if we can actually do a lot of this care locally, and a lot of it we can do, especially with the kind of tools that the paramedics have for emergency care, let's include everybody that is part of response. And that includes some of the people I work with, medical assistants, nurses, LVNs, et cetera, that can be trained to do a lot of this work under supervision and communication. To be able to do it well. Eric, thoughts?
So I think the question is, how do you get, I was going to say left of boom because I used to be in the Navy, but get ahead of the event. And so how can we prevent complications that we know that will occur with wildland fire? So I love the idea of community paramedicine, empowering your paramedics to do preventive care or routine healthcare maintenance. Seeing in the chat box about how can we get air filters and air conditioners that have MERV 13 or better in their systems, getting those out and messaging about those so we can prevent those respiratory issues that will happen with wildland fire smoke, building out clean air centers or cleaner air centers so that we can prevent injury. The other thing I don't think we've mentioned is telehealth and being able to reach out to our populations remotely. And for us in the rural communities, that goes back to a broader issue of how do we improve our access to all things internet and rural broadband. Because I think going back to Joan's point is, this is all, whether it's the pandemic, whether it's fire, it really is related to our carbon footprint and climate change, and we're not going to be able to have a significant impact on that from our perspective. But what are the small things we can chink away at to make a more resilient community?
Yeah, I guess this goes back to data, and Marty Lynch has put about a good database to inform some of those strategies for engagement. Matt, do you want to say something about the data needs and what kind of strategies we could use to be better targeted?
Yeah, I mean, so I think there's so much to say there, right? But I think, so I actually just had this conversation, but I think pushing for interoperability between healthcare systems is like a very basic first step. Like I found out that here at Stanford, the two hospitals, the children's hospital and the adult hospital, actually have different EMRs. So you can't even like exchange data between the same system, right? So things like that. And I think that that's just legislative. We have to incentivize that with money, and we have to force that on companies or they're not going to do it. And so, yeah, and I think the ability to anonymize and use differential privacy and like those concerns are manageable now. We have the math and technology to overcome those concerns, and I think the legislation and the laws need to adapt to that in order to make data useful for us, but also for the public sector broadly. So, yeah.
And I just chime in one more thing. Thank you, Matt. That's reminded me that we all need to get paid to do this. In other words, we need to have a sustainable financial model that pays to help this prevention and to allow us to get to and use new models of care that save total cost of care down the road and show good data. Thank you, epidemiologists, to be able to show this and spread this. Right now, we get paid perversely. In other words, the sicker people are, the more often we see them, the more we get paid. We need to change that.
I mean, just really quick, we don't have very much time left, but one question I've been interested in this year is that around this issue of prevention is that, you know, one of our common responses at the population level is to distribute masks to protect people from wildfire smoke. And we, you know, because of the pandemic, now people have gotten very used to wearing masks, at least, although there's quite a bit of, you know, hostility in the other direction. Not all masks protect the same way, and actually things that protect you or, you know, protect other people from COVID don't necessarily protect you from wildfire. Is there any concern about the messaging around this year, around, you know, what kind of mask actually do you need, and making sure that people don't mistakenly think that they're actually protected because they're wearing a surgical mask, you know, even though that doesn't really do you any good from wildfire smoke?
So I'll go with that, is that, yeah, there's actually a lot of really good, at least in California, information about using N95 respirators. I think that was one thing that we've used over the last, say, 4 or 5 years, now 3 or 4 years, with messaging about wildland fire smoke. And if you need to be out in the environment, is that you do need a respirator, and recognizing there is a difference between a respirator and a mask. And I think that's, in terms of messaging, that's an important thing that we can all share.
Good point. And COVID will be over. And yes, we'll have flu season. So it may be that people will need a wardrobe of masks, unfortunately, for different purposes.
It'll be a future of many masks. Well, I'd like to thank everyone for your time and for, I think, all of your insights. This is a long-term ongoing research area and practice area for crisis ready and for direct relief as we gear up to support the safety net and to support you know, resource needs throughout the state and throughout the country as we kind of move forward into deeper into wildfire season. So I think we'll be revisiting this many times over the upcoming months, and we thank everyone for the collaboration around this. So and thank everyone on the call as well. Please feel free to follow up with us with any additional questions. And this video will be posted to our site, crisisready.io, and we will be circulating it to everyone, and you can find it back on the Crisis Ready site as you at your leisure. So thank you very much, everyone.
Thanks.